As family sizes shrink, less and less of us have siblings who can be used as donors, and so we have to turn to unrelated donors. And unfortunately, most of the donors today in the registry are actually of European descent. And so it means that if you're of mixed heritage or if you're a minority patient, the likelihood of us finding you a donor in the registry is much lower. And so there are two fundamental approaches to trying to overcome this donor shortage, if you will. One is to try and expand the pool of donors to include minorities, and the NMDP, the National Marrow Donor Program, has a lot of outreach efforts in that regard. And then the other approaches are to look at what kind of grafts we can provide to patients. So the strategy we focused on Memorial is cord blood transplant, and we have an active program led by Juliette Barker. And there are two studies I'd like to highlight at this year's ASH on cord blood transplant. The first one is actually looking at this question of donor and ancestry. And so what we did is we looked at about 800 grafts and compared so cord blood grafts and unrelated donors. And we looked at the availability of donors for different populations. And we looked where we were about 5 years ago and where we are today. And what we've seen is that for Europeans, in most cases we can find an unrelated donor. And when we can't find an unrelated donor, we're able to find a cord graft. And so there's a very small percentage of Europeans who don't have a donor option. Whereas when you look at patients of African descent, for example, either African Americans or patients from Africa, in that case, about a quarter of them have no graft. And now what we've seen is actually an improvement in the last 5 years that more of them are able to get a graft. But there's still an unmet need there in terms of providing stem cell grafts to these patients. And so that's an area obviously that we're working on to develop further. And that's work that will be presented by my colleague Paras Tudahi. And then the other interesting paper that Juliette Barker is going to be presenting today is looking at one of the limitations of cord grafts is that the recovery after transplant takes longer. And so the count recovery takes longer, patients are in the hospital longer, they need more transfusions, they have high risk of infections. And so one approach to try and overcome that is actually to give the patients the cord blood transplant, but in addition to give them some stem cells from a half-matched donor, what we call a haploidentical. Now when you give stem cells from a haploidentical donor, the risk of graft versus host disease is extremely high. And the way we get around that is we basically, again, use T-cell depletion. So she's combining a double cord blood graft with a T-cell depleted or CD34 selected haploidentical graft. And what she's seen now in about 20 patients that we've already treated is that in most patients there is early recovery in their counts, which is coming from the haploidentical graft. And then eventually the cord blood graft takes over. And so what we're seeing is this early recovery, the hospital stay is shortened by about 10 days. And although we don't have formal data yet, we suspect that the risk of infection is also going to decrease. So I think when we have a large enough study, we'll probably see better outcomes with this approach as well.